Hi, thank you for joining our webinar today. My name is Isabel Jones with the Healthcare Authority. If you are dialing in by phone, please use the dial-in information below, or you can use your audio on your computer. Everyone is going to be muted today, and if you have questions as we're going along, if you could please type them into the chat function. We will leave some time for questions at the end of the webinar, and we'll go through your questions at that time. And with that, I think we'll get the webinar started. So the purpose of this webinar today is to talk about our upcoming integrated managed care request for proposals to select the managed care plans that will offer integrated coverage throughout our state by 2020. And we sent out an electronic version of a comment tracker today. I think it was also sent out a week ago or so. And if you don't have an electronic version of the comment tracker, you can contact Samantha Zimmerman. Her email is included on this slide, and she can email it to you. We're asking for feedback on in the comment tracker by January 10th, 2018. We are working to release our procurement in the near future, and so we appreciate receiving comments by January 10th, 2018. And we also sent out a link to the North Central RFP documents. This is the most recent RFP that we've done for integrated managed care. And if you registered for this webinar, you should have received an email about an hour ago from Samantha Zimmerman that included both the comment tracker and also a link to what's called Exhibit C1. Those are the questions from the North Central webinar. I would strongly recommend that you click that link and open up the Exhibit C1 during this webinar, as we are going to be referencing back to those questions throughout the webinar. So I wanted to start the webinar just by talking a little bit about the objectives for the Integrated Managed Care Program. And these objectives are pulled directly from our most recent RFP. The first objective is to provide the full continuum of comprehensive physical and behavioral health services for the managed care plans to involve the enrollee support system and to provide care coordination across multiple systems, to develop appropriate systems of care and improve access to care for enrollees with high needs by linking the crisis response system, community resources, and clinical services, to maintain a network capable of ensuring access and continuity of all covered services, including behavioral health services, to provide seamless transitions based on the enrollee's needs and the enrollee's rights, to ensure continuity of care for members during the transition from the current BHO system to the Integrated Managed Care Program, and to partner with the accountable communities of health and other regional stakeholders to improve the health and well-being of regional service area residents. So those are some of the objectives that are outlined in our RFP, and you can think of those as kind of our high-level goals for this program. So before we talk about the questions, I just wanted to give a couple key dates for our upcoming timeline. So we are projecting to release the RFP on February 15th, 2018. We do reserve the right to amend any of these RFP dates at any time. So keep in mind these are projected dates. Our projected deadline for the proposals to be submitted would be April 12th, 2018. And then it takes approximately a month or so to score the proposals. So we're projecting that apparently successful bidders would be announced on or around May 22nd, 2018. This upcoming procurement is the last procurement that we will do before 2020 implementation of integrated managed care. So it's going to have two effective dates, and those effective dates are different depending on whether the region is what's called a mid-adopter, which means they're implementing in 2019, or an on-time adopter, as we sometimes call it at Healthcare Authority, which means that the region is implementing in 2020. So it's one procurement, and it has multiple effective dates those being January 1, 2019 or January 1, 2020. The focus of this webinar is really for the January 1, 2020 regions, which we have 3 2020 regions in the state. Okay, I'm just going to go over a couple other basics. So first of all, it's important to know that the procurement is only open to managed care plans that already have Apple Health contracts in Washington State. We have 5 active managed care plans in our Apple Health program, and we are not opening this procurement to additional managed care plans to apply. So only the 5 that are already serving the Apple Health program can apply. The procurement is focused on the addition of new behavioral health services. Because we are limiting the procurement to our existing Apple Health plans, which are already under contract with the Healthcare Authority and monitored regularly, we don't need to focus this procurement on questions related to their current contracts for medical services. The procurement is really about the new services that they will be taking on and how they will coordinate those with their existing medical program. So you will not see questions as we go through this document that are focused on really the medical side. So as I mentioned, we are requesting comments from the 2020 regions on the statewide RFP questions and recommendations for any new questions by January 10th, 2018. A comment tool has been made available. As we go through this webinar, please know that we're talking about the North Central RFP questions because legally we can't share questions for this procurement, before the procurement happens. So we are talking about the North Central RFP questions, which kind of have been the basis for the upcoming RFP. So just keep that in mind when you're commenting. Okay, so first I would just want to talk through some of the content areas that were included in the North Central RFP. And then as we go through this webinar, we're going to go through each content area and talk about it in more depth and what types of questions we ask in that section, and then we'll highlight a few key questions where we are hoping you can review and provide comment. So the bidders must respond to questions that are related to various sections and topics, and each question is scored. Separate from the questions, the bidders also submit a network of providers. For this RFP, there will be a staggered network submission, and the details of those due dates will be released with the RFP. Additionally, not every question or section is weighted equally. Additional weight is given to the questions that are deemed a high priority. So as part of the comment tracker, you are asked to look at certain questions, and then you also have an opportunity to rate them in terms of importance or priority. And that's very helpful to us because we don't weight each question the same. Some are a higher priority, and those should be weighted as such. Sections in the North Central RFP were divided up into 8 sections, and those are managed care management, behavioral health access, network description, community linkages, quality assessment and performance improvement, information system and claims, utilization management program and authorization of services, and care coordination. And so now we'll talk through each of these sections in more detail. And at this point, again, if you are able to click the link that Samantha sent and go to the document titled Exhibit C1, that was the question set for North Central. And as you can see on this slide, we reference certain question numbers, and those are referencing the questions from the North Central RFP. So where it says questions 2 and 4, I'm referring to questions 2 and 4 in that Exhibit C1 document. So the management section in the prior RFP had 9 questions, and it's focused on the bidder's internal management and their organizational structure to ensure that all functions and contractual obligations can be effectively fulfilled. So some questions that we'd like you to look at would be To start, question number 2, which talks about essential behavioral health administrative functions, and then asks the bidder to fill out a grid regarding whether those functions will be done in-house, meaning under the direction of the Washington State Health Plan CEO, or delegated to a subsidiary organization. And the administrative functions are grievance and appeals, network development and management, provider relations, provider training and clinical oversight, quality management, data management and reporting, and claims and financial management. And so here, I think what we're interested in having you look at is basically the list of these functions and whether you think anything might be missing. Again, question 4 is also related to this, and asking the bidders whether those will be provided by the bidders organization in-house or whether they will be delegated, and then a plan for bringing them in-house if they are delegated. So those are 2 for you to look at. And then also question number 6 is a question about augmenting the customer service line to account for the new behavioral health services that they'll be providing, and augmenting their customer service line to ensure, number 1, that it's properly staffed, but also that the call center staff are trained in behavioral health services, crisis triage, the geography of the state and the regions, also information about non-Medicaid dollars and how those should be handled. So this is a good question to look at. Just please comment and let us know if there is anything you think we could do to improve this question. Of course, the health plans will be responsible for behavioral health services that are new, that they're not necessarily responsible for today. So this question is really trying to get at how are they going to kind of change their customer service processes to make sure they have enough staff, but also all the appropriate information related to those services. Okay, we'll go to the next slide. Do we have any critical questions yet? Okay. So the next section is about behavioral health access. And this, in the North Central RFP, it included 6 questions that ask the bidders to demonstrate how they'll ensure access to behavioral health services. So if you want to direct your attention in Exhibit C1 to question 11, this asks the plans to describe how they will ensure access to necessary evaluation, treatment, and inpatient psych services, specifically addressing referral processes and current contracts with facilities, policies and procedures for managing beds, transport of clients to ENT, and use of single bed certification processes. So we'd love your input on this question. We want to know if it provides enough emphasis on inpatient options. Are there other services that could be hard to access that should be highlighted? Should we ask a specific question about ENT services? Any feedback that you'd like to give us on this question would be appreciated. The next one is question 12. This is focused on substance use disorder treatment. We are, again, interested in your feedback if you think that anything is missing here. This question talks about both mental health evaluations and SUD assessments being offered in all living situations, including adult family homes, assisted living facilities, skilled nursing facilities, as well as residential SUD facilities, and treatment for individuals who are in an institution supervised by the Department of Corrections. So if you think anything is missing there or that could be improved upon, please send us your comments. And then, oh, I don't think question 13 might be referencing the wrong question. Well, question 13 is about the state hospital, so we would certainly appreciate your input on that. And then I think that comment may have been referencing another one. Sorry about that. So The next topic is about network description. So as I mentioned at the top, the network submission itself is scored separately, and that is the evidence of actual provider contracts being in place. But we also have a section of the RFP called network description, which asks the bidder about their approach for contracting with providers, implementing value-based purchasing, and complying with things like the class standards. We are interested in your comments here, especially regarding things like the Essential Behavioral Health Network. Hold on one second, let me get to the right section. The Essential Behavioral Health Network, oh, here, can you put us on mute for a second? Sorry, we're going to take a break for a second to make sure that all the numbers here line up to the right question. I won't. Okay, we're back. So question 16 is about contracting with essential behavioral health provider types across a region. And it asks about ensuring access to the full continuum of services for men, women, children, and youth, plans for contracting with Indian providers, plans for establishing capacity outside of a region, including bordering counties. And then again, asking questions about how the network will address specific needs of individuals who have been referred through the Washington State Department of Corrections, juvenile rehabilitation, or identified through activities funded by the Criminal Justice Treatment Account, and then also ensuring access to crisis stabilization. So I think on this question, we would be just interested in knowing if you think any key provider types that are not called out that should be included in this question. Question 17 is about ensuring technical assistance is available to behavioral health providers. We certainly would appreciate, especially providers, commenting on this question. So in our experience in both Southwest and North Central, providers have sometimes been challenged in changing their billing systems to be able to bill managed care plans or submit data to managed care plans, which can be quite different than how a provider might have been used to working with the BHO. So question 17 is one that essentially has a vignette. And again, this is one that is based on North Central, so we would love your comments because we know that it can be very different from region to region. This is about a provider who delivers SUD outpatient services, has been reimbursed on a subcapitated model, and has not submitted claims or encounters before. They use the My Avatar system, which is funded by the BHO, and they don't have a practice management functionality. And then the question asks the bidder to talk about what training they would provide to this type of provider so that they're ready to submit HIPAA-compliant encounters or claims before go live. Describe what the bidder will do to work with the provider to rapidly resolve any rejected encounters, to quickly identify and resolve errors in the submissions before they become widespread, and to address other billing issues after the go live of implementation. And then we also, in this question, ask the bidder to tell us how they will assist providers in learning how to check eligibility for other coverage, or use level of care guidelines and protocols for mental health and SUD services. So this is really a question for the bidders about what type of technical assistance and training they might give to providers. Again, this was written for North Central, so you may have a different type of vignette that you want to suggest, and we would very much appreciate comments on this one. And then question 20 is about network transformation goals. So as you probably know, one of the main goals of integrated managed care and integrating the contracting and financing for services is to set a foundation for integrated clinical services. And so this question, number 20, talks about how the bidder would use incentives or alternative payment arrangements to achieve network transformation goals. And then it asks them to address things like the development of clinical integration through provider co-location, or improved coordination across clinics and agencies, or the use of collaborative care models using elements of the BRIE collaborative, rewarding providers who are willing to engage with complex high-risk clients and who use evidence-based practices, plans to increase the proportion of both physical and behavioral health providers in value-based purchasing models, and then how the bidder's performance measurement strategies address the unique challenges of rural providers who see a low volume of patients. This is one we're certainly very interested in comments on from all stakeholders, so please let us know. Okay, we're going to go on to the next section, community linkages. And this section has 5 questions, which are focused on linkages between the bidder and the ASO, and then also the bidder and the accountable community of health. So if you look at question 21, this is a question that's focused on the relationship between the managed care plans and the Behavioral Health Administrative Service Organization. This is an entity that will be in each region of the state, and it's the payer for crisis services for both Medicaid beneficiaries and non-Medicaid clients. And then this organization also administers many of the other non-Medicaid funds. And the ASO, the managed care plans are required to contract with the ASO for the Medicaid reimbursable crisis services that are delivered to their members. So they have a contractual relationship between the managed care plan and the ASO. In multiple regions of the state, the existing BHO has opted to become the BHASO in the future. And I believe in all 3 of the 2020 regions, we've actually received a letter from the existing BHO stating that they intend to take on this role as the ASO in the future. So please keep that in mind as you're looking at these questions. So this question really asks about that relationship, their plan for data exchange and monitoring of services to people who are delivered to their enrollees by the BHASO, and then their plan for care coordination for people who have accessed crisis services or under an Involuntary Treatment Act order, and providing preventive services and interventions to follow up on the receipt of crisis services. So please let us know any comments on that one. I don't think we've called them all out here, but there are other questions about the ASO, such as what type of payment mechanism would the bidder propose with the ASO, well, this next one, 22, is about aligning administrative processes with both other payers and the ASO with the goal of alleviating the administrative burden on providers. So we would appreciate your review of both 21 and 22. And then certainly if you want to comment on any others, we're very open to that. We do have one more in this section. It's actually on the very last page, page 18 of 20, but it's technically part of the community linkage section, and that's question number 53. And this is one that we certainly would appreciate comments on. This is about capacity building in an integrated managed care model. This is something that we've heard a lot about from accountable communities of health and counties and providers, because as we move forward into this new purchasing model, there is no longer one centralized organization in a region that manages all the funding, both Medicaid and non-Medicaid, for behavioral health services. Much of that funding is now divided amongst multiple responsible entities. And what that means is there's no longer a centralized entity that can conduct all of the planning work necessary for kind of capacity building of services. And so this question is about that, and it asks the bidder to talk about what their commitment would be to assist in assuring adequate capacity in a region and what resources they would use to achieve that. What processes would they use to monitor expenditures of non-Medicaid funds and establish a budget for capacity building investments? How would they collaborate with other payers and stakeholders on regional investment opportunities? And then how would they evaluate proposals for startup funding or infrastructure development from behavioral health providers? So please take a look at that one and let us know any comments. Okay, now we're going to flip back a few pages to the quality section, which starts on page 10. And this section includes questions about the bidder's plans for quality improvement, performance improvement projects, and reducing readmission rates. We would direct you first to question 25. This is about a bidder's quality improvement program and kind of describing what that is. It asks them to list all of their quality-related committees. So if you want to take a look at that and let us know if anything seems missing to you, that would be helpful. We have a question. I'm not sure it is actually question 26, but it's about the quality improvement plan. Okay. The one about the picture. So I think question 26 is about performance improvement projects related to behavioral health. So if you want to look at that one and let us know comments, that will be helpful. And then 27 is about how the bidder will monitor readmission rates for behavioral, for individuals who have complex both physical and behavioral health conditions, and what specific interventions would they employ to address outlier utilization patterns. That's another question that we would appreciate your review of. Okay, the next section is about information systems and claims. This section includes questions that are related to their plans for implementing IT systems to implement a new benefit package of behavioral health benefits, and also questions about claims payment and counter submission and plans for conducting coordination of benefits. And we would direct you to look at first question 31. This is about their plan to update their procedures for coordination of benefits with other insurers, including the Indian Health Service. And then it talks about details related to identifying other coverage, post-payment recovery for third-party liability, how they will address third-party liability and managed care, how the bidder will address dual-eligible clients that are enrolled in a different product called Behavioral Health Services only, and then how they'll comply with 42 CFR. So that would be a helpful one, especially I think for BHO folks to look at to let us know if you think there's anything missing in that question. And then question 34 this is the question that's about the reimbursement methodology from the managed care plan to the ASO. And through many stakeholder meetings, we've had conversations about the fact that a fee-for-service methodology is very challenging when it comes to crisis services because it's a service that has to be available 24/7 regardless of whether it's being accessed or not. So this question talks about how the bidder would contract and what type of payment methodology they would put in place with the ASO. And we do have on here that a maximum score requires a prepaid capitated arrangement. And then lastly, question 35 is about behavioral health data exchange. How will the bidder incorporate written and signed disclosure with consent for FUD treatment? How will the bidder share confidential information between medical and behavioral health providers for the purposes of care integration? Okay, the next section is about and authorization of services. And this question is about their policies and protocols and policies for authorizing behavioral health services. If this is something that you're highly interested in, you may want to just review the entire section and let us know comments. But we did want to call out questions 36 and 37, which are about the workflow for decision-making for behavioral health services, and then also about, on 37, the level of care guidelines that the bidder would propose for behavioral health services. So please take a look at those two. Okay, and then I believe this is the last section is care coordination. And this section has questions related to how the bidder will coordinate care across the full continuum of physical and behavioral health services. This is the section that has the most questions really about clinical integration and changing care coordination strategies when you are able to coordinate care across the full spectrum of services. This is probably the section that in the past we've gotten the most comments on. So you may want to just review this whole section if this is a topic that you're interested in. But we have called out some questions that we would especially appreciate your review of. The first one is question 43, and this question asks the bidder to describe how they'll develop a system of care and support providers in using community-based practice level approaches, including care coordination and recovery support services that are tailored to the needs of specific populations, including but not limited to, and then there's about 6 or 7 different bullet points that call out many different populations. So it really asks them to describe how they will develop a system of care specific to various populations. Number 45 is a question about how the bidder will implement alternative care options, including the use of telemedicine, psychiatry, telepsychology, and remote psychiatric case review and consultation to a primary care team for rural, urban, and geographically isolated communities. And then it specifically asks them to answer this question tailored to clients with physical, functional, or behavioral health disabilities who are unable to travel, and then clients who do not require specialty behavioral health services but who have moderate symptoms of depression or other common mental health concerns that can be treated in a primary care setting. So this would be a question that we would appreciate any comments or feedback on. And then question 47 is about the bidder screening and stratification processes for care coordination, talking about essentially how they will determine which enrollees would receive level 1 or level 2 care coordination services. And then question 50 is about how the bidder will ensure that healthcare information is available to primary care providers, specialists, behavioral health providers, care managers, and other appropriate parties. So this is really about sharing healthcare information across provider types and making sure that all confidentiality standards are maintained. So I think those are all the sections comments to Samantha. We're happy to kind of take your comments in any form. And we are asking for comments by January 10th, if possible, to Samantha Zimmerman at HCA. During your review, if you could also consider how much weight or points any given question should be assigned, what needs to be strengthened, do you think any sections are overly prescriptive, do you think that we've left anything key out, and are there questions that you just don't think make sense? If you could keep all of those in mind as you're reviewing, that would be helpful. And then I think with that, we'll open it up for questions. If people want to type questions into the chat box, we can read them out loud to the group. So we have one comment that says, I think a question specific about E&P is necessary, as many of us operate one. Okay, thank you. If other people have questions or comments, you can type them in with the chat function, and then we can read them out loud. Okay, we haven't gotten any additional questions into the chat function. Maybe we'll ask one more time if anyone has any questions or comments that you want to add. Oh, we have a new one. It says, if providers operate their own E&T, there should be a question about how they will be monitored independently from the ASO. Okay, thank you. Okay, that's from Greg Endler. Elia asked, can the deadline be extended to Friday? I mean, you can send us comments by Friday, but we will have a better opportunity to incorporate them if we can get them by the 10th. I think that the tracker was sent out prior to this, about a week before, which we had hoped would give people an opportunity to look at it and perhaps start on their comments in advance of this webinar. But given our RFP timeline, we may not be able to take comments that come much later than the 10th. The next question says, are most BHOs who are going to become ASOs going to contract with the behavioral health agencies? So what I can say about that is that the primary role of the ASO is to be the payer for all crisis services. And by crisis services, I'm really referring to the initial crisis services such as DMHPs and mobile crisis outreach, not necessarily any downstream services such as evaluation and treatment. So the payer for crisis services, and then also for services for non-Medicaid individuals, which could be, you know, a wider array beyond crisis, in which case they would likely contract with additional providers. And then the ASO also is the payer for the majority of non-Medicaid funds, such as the CJTA funds, the block grant funds, which oftentimes would require them to contract with providers outside of just the crisis agencies. So it really, I think, depends on the ASO and the different funding streams and what they're used for. So I would recommend you talk about that with your BHO. Did HCA consider input from Medicaid beneficiaries when determining the number of plans that will serve each region? If not, why not? We did send out a memo very widely about the number of plans that were being proposed for each region, and we received comments from all across the spectrum: behavioral health providers, physical health providers, consumer groups, and accountable communities of health, managed care plans, counties. We received all sorts of comments from various stakeholders, and we've certainly taken them all into account. Are the managed care plans required to contract with behavioral health agencies? Yes, the managed care plans are required to meet network adequacy requirements, which require them to contract with behavioral health agencies. The next question is, are the regional service areas the same as the accountable communities of health? That is a good question. The answer to that is no, not exactly. The Cascade Pacific Accountable Community of Health includes two separate regional service areas. That would be Thurston-Mason and Timberlands. I think that's Great Rivers, yeah. So the Thurston-Mason BHO and the Great Rivers BHO are technically two separate regional service areas that are covered by one accountable community of health, which is the Cascade Pacific Action Alliance. So I know that's caused a little bit of confusion, it seems like, for people. And I should say that we are doing our procurement. We consider those to be two separate regional service areas for the purposes of Medicaid purchasing. So there will be apparently successful bidders announced for Thurston-Mason and for Great Rivers as two separate regions. And then Olympic, which includes the Salish BHO and regional service area, is one region. Okay, the next question says, would you mind repeating? I thought I heard that all 5 mid-adopter region BHOs intend to act as the ASO, and that the 3 2020 regions had submitted letters of notice of their intent to do so. So with respect to the 2020 regions, yes, Great Rivers, Salish BHO, and Thurston-Mason have all informed us that their BHO intends to convert into the ASO. With respect to the 5 mid-adopter regions, Pierce County has said that they do not plan to operate their own ASO. King and North Sound and Greater Columbia have all voted that they do intend to operate their own ASO. And then Spokane has not made a final decision yet. Okay. That is all the questions we have so far. I'll pause for a minute, and if people have additional questions, please go ahead and type them in. Somebody says, can you publish the information regarding the regional service areas that you just explained? Yes, well, it will be outlined in the RFP. And that will be public once it is released. So we can make sure people have like a link to the RFP when it comes out. Are there any other questions or comments that people want to type in? We have another question about the ASO process, and I'm actually not sure it's one we can answer publicly on this webinar, so I apologize to the person who just asked that, but I don't think we can say that answer to that on this webinar. Okay, we'll pause for one more minute and see if a couple more questions or comments come in, and then if not, I think we will close the webinar. Okay, we have not received any additional comments or questions. So with that, I just want to say thank you very much to everyone who joined and for your questions and comments. Again, please, if you can, submit comments to us in the tracker or just even in an email, send them to Samantha Zimmerman by close of business on January 10th, and we look forward to seeing your comments. Thank you.